All right, you're live.
Hi guys, it's Dr. Jill and I'm here at Emerage Medical. Today we're going to talk about how hormones can affect your skin because here we help your outer glow match your inner glow. So a few things to think about when people think about skin mostly is acne, dry skin, wrinkly skin. So they're all different hormone levels that actually affect it. One of the things that I've been seeing lately is acne. So a lot of people think that hormones only affect older people, and the reality is hormonal decline starts as early as late 20s, early 30s. One of the most common ailments that I see for acne is something called PCOS, or polycystic ovarian syndrome. And this is primarily younger women that if you look on the internet, Dr. Google, it will actually say that you have to be like overweight and hairy. And honestly, most of my patients that I've seen with PCOS are thin and petite and not hairy. But one of the hallmarks is they will have acne. If you do have excess hair growth, that's another sign. So this is something that is very much treatable with hormones. And actually, it's imperative that you catch it early because people with PCOS are at higher risk for breast cancer and endometrial cancer because of the estrogen dominance. So that's one level that we look at. Testosterone is also a little bit higher in people with PCOS and can cause like that oily skin that can create more acne. The other skin condition that I see a lot of is dry skin, like dry, itchy skin. I've literally had patients go to see dermatologists, allergists for this like crazy dry skin that they can't figure out what the problem is. And there's multiple hormones involved with this. And again, age is not, a number. Age really, it affects any age. So anywhere from like 20 to 80 is what I see. But dry skin can be affected by estrogen levels. It can be thyroid levels. It can also cause that can cause dry eye, but you don't necessarily have to have like weird rashes or anything. It's just that dryness. So like I said, I've had people see specialists. Once their hormones are optimized, they get rid of the dry skin. Now crepey skin, that like old lady skin that we hate to see, that's a lack of growth hormone. And it's also because of loss of muscle tone, which is because of lack of testosterone. So we women need testosterone as well. We're not going to get like beefed up, it will actually help to puff up the muscle a little bit to fill out that skin that's kind of like just hanging there, that looser skin that we don't like. We get it like on our lower belly, we get it on our arms. I'm not going to show you mine right now. But those are things that affect men and women. The other thing is testosterone does give you a little bit of conversion over to estrogen, and this helps to both estrogen and testosterone help to plump collagen production, which is what we need for our facial fullness. So men and women notice a difference with like their facial features as far as having a more youthful glow, even after just 1 month of treatment. So these are a few common skin conditions that I see with hormonal decline that are really easily treated, and you usually will see a difference within like the first month. Any questions?
Yeah, so for PCOS, what are some possible treatments that would be an option for them?
The most common treatment that most traditional doctors will offer is birth control, which is not a good option in my mind because it's a one-size-fits all. And you are more than just your number. You are a unique patient, so I recommend seeing a hormone specialist like myself so that I can really optimize the levels. Again, the problem is estrogen dominance, or too much estrogen can cause the weight gain, fertility issues, period issues. So the hormone that's really needed is progesterone with that. The other hormone that's needed generally that causes a problem is testosterone overgrowth, and it's a matter of balancing all of them.
Great. Those are all the questions.
Okay. So thank you for joining me. Like I said, here at Emerage Medical, we help your inner glow match your outer glow.